The three of us had the privilege of going to New Delhi, India, and we had the opportunity of working at Dr. Schroff's Charity Eye Hospital, which was a fantastic experience. So for the 2 weeks, we did a little bit of clinic and OR experience. Our mornings, we were focused in the operating room learning a different technique of cataract surgery called cataract surgery. And it's a surgery that is not commonly done here in America, but it's really important to learn how to do because sometimes you will have the patients that you need to do it on. And sometimes you have cataract surgeries that you don't plan on doing it on, but they go bad and you need to convert to it. So it's a really important skill to learn, and just one that we don't really get to learn here. So that was excellent. And then the clinic was really nice in the afternoon. We went there to be able to see diseases that aren't commonly seen here in our clinics, and just advanced manifestation of diseases that we also don't see here. So it was just a phenomenal learning experience.
It's a great opportunity to really put the whole package together for your surgical skills, and I definitely feel a lot more confident coming out as a surgeon after doing that experience. So surgically, to me, it was great.
In 2 weeks there, I got more experience on certain diseases and surgical management of certain diseases than I ever would really in 3 years of ophthalmology residency, and probably a lot more than that actually.
We were fortunate to have a fantastic alumni come on the trip with us, Dr. Jeremy Van Buren, and he provided just a lot of mentorship with career planning and just life planning as well. And that was a perk that I wasn't expecting, but something we really got out.
And our own faculty, Dr. Judy Chen also came with us along with Dr. Van Buren as the other faculty member, and I think Dr. Chen was able to bring a lot of the neuro-ophthalmology expertise that she has from here and translate it over to the Dr. Schroff's Charity Eye Hospital, where they don't have a lot of neuro-ophthalmology training and a lot of neuro-ophthalmology clinical experience. So I think she was able to bring a lot of really good things that we know of here to be able to help them there.
I think the primary reason why we had this trip was for the surgical experience. So I would say that's probably, what I got was most valuable, and the favorite part for me was to experience that. But even just the people were just so lovely. They were great hosts, very, excellent with us, teaching and making us feel included, feel welcomed, helping us figure out where to go and where to eat, and sort of how to experience the culture while we were over there too. So, but it really almost everything was the favorite.
I agree, surgically it was definitely the highlight, but in terms of the cultural experience, just from the way they scrub, from the way they drape, from all these little nuances that we kind of take for granted, all these little things make you a complete surgeon, and you see how different people in different parts of the world manage, and they provide excellent eye care to a lot of different people.
Other things that I'll never forget that were really fun is the simple things like trying to cross the street in Delhi while staying in one piece. That's a really big deal.
We had some fun pictures of us running across the street.
We all made it without incidents, but there was more than one close call.
I wanted to go to a residency program that has an international experience, and that was something very high on my list, and this clearly fills that need. I think it just makes you such a well-rounded surgeon, physician, and general global citizen to understand how the rest of the world functions.
All the donations that support this program, we really appreciate it.
Yeah, this was a phenomenal experience, and we really appreciate it.
Being able to experience this wonderful trip, we learned so much, and it's just unforgettable, and just was fantastic. So thank you.
We'll make sure to pay it forward.
We will.